Namaste Vidya. Myself JV Neha Saini from Physiotherapy and Diagnostics, Jyoti Vidyapeeth Women's University. Here I am going to tell you about the anatomy of the femoral nerve. Femoral nerve is a branch from lumbar plexus. So this network is formed in the lumbar region to provide innervation to the lower limb. So this is the lumbar plexus arising from L1 to L5 spinal nerves. Now femoral nerve is formed by the ventral rami of upper four, that is from the L1, L2, L3, L4 spinal nerves. Sometimes L1 is absent within the substance of the psoas major muscle. So this plexus is formed in the substance in the muscle fibers of the psoas major muscle, and the main branches of this plexus is the iliohypogastric ilioinguinal nerve, which supplies skin of the anterior abdominal wall. Then it also provides genitofemoral nerve, which supplies to the skin of the thigh and the cremaster muscle. Then it also provides obturator nerve, which is providing innervation to the adductor group of muscles of the thigh, and also provides the femoral nerve, which is providing innervation to the muscles of anterior compartment of the thigh. So these are the branches of lumbar plexus. Now femoral nerve. Here we discuss that is the femoral nerve. So femoral nerve originates from the lumbar plexus and the root value is L2, L3, L4. Course, it descends lateral to the psoas major muscle and then enters into the thigh behind the midpoint of the inguinal ligament. Midpoint of inguinal ligament means the midpoint between the attachments of the inguinal ligament. Attachment is from anterior superior iliac spine up to the pubic tubercle. Then it passes lateral to the femoral artery and then divides into anterior and posterior divisions. It provides muscular branches. Muscular branches are first given off to the psoas and then to the iliacus muscles before the nerve runs beneath the inguinal ligament, because these muscles are lying in the posterior abdominal wall. So the innervation of these muscles is provided before it is passing through the inguinal ligament. So this is the femoral nerve arising from L2, L3, L4. Then it enters into the pelvic cavity and then it passes beneath the inguinal ligament from the midpoint of the inguinal ligament, and then it enters into the anterior compartment of the thigh. This is the cutaneous innervation of femoral nerve. It is providing intermediate cutaneous nerve of the thigh, medial cutaneous nerve of the thigh, infrapatellar branch, and the saphenous nerve. This is the femoral nerve. Again, its origin from the lumbar plexus, L2, L3, L4. So, the muscular branches of the femoral nerve. In abdomen, it provides branches to iliacus. This muscle is the flexor of the hip. In the lower limb, it is providing muscular branches to the muscles of anterior compartment of the thigh. These muscles are the flexors of the hip joint again. These muscles are sartorius, pectineus, and extensors of the knee joint, that is quadriceps femoris. Now the cutaneous branches of the femoral nerve. To the anteromedial aspect of the thigh and to the medial side of the knee, leg and foot. These are the cutaneous innervation, cutaneous areas which are supplied by the cutaneous branches of the femoral nerve. Lateral thigh is not supplied by the femoral nerve but is innervated by the lateral femoral cutaneous nerve, which is a direct branch from lumbar plexus, that is from L2, L3 nerve roots. So this is the cutaneous innervation by the femoral nerve, intermediate and medial cutaneous nerve of the thigh. So this blue colored area on the anterior aspect of the thigh, this is the area supplied by the femoral nerve. Then this is the saphenous nerve area. This pink colored area is the area of the skin which is supplied by the saphenous nerve, which is a branch of again the femoral nerve. And here we can see the entrapment of the lateral femoral cutaneous nerve in the inguinal ligament, which is termed as meralgia parastatica. So if there is entrapment of the femoral nerve, or if there is injury to the femoral nerve, it causes some effects like paralysis of iliacus, sartorius, pectineus and quadriceps femoris. Because of these paralysis muscle, the movements affected are: there is loss of flexion of the hip, flexion and abduction of the hip, flexion and adduction of the hip, and because of the injury to the quadriceps femoris, there is loss of extension at the knee. Now, what are the sensory effects? There is loss of sensation over the area of the skin, that is on the anteromedial aspect of the thigh and medial side of the knee, leg and foot. There is loss of sensation in these areas also. Now, how the patient present in clinics? They develop buckling of the knee from quadriceps weakness, difficulty lifting up the thigh. There is dragging of the leg. For testing, the patient arises from the floor from the kneeling position. Weakness of the hip flexion is an important sign because it indicates involvement of iliopsoas muscle localizing the lesion proximal to the inguinal ligament. So this completes our topic. Now the questions for this topic are: enumerate the branches of femoral nerve. So here we will list all the branches of the femoral nerve from the. So we have discussed earlier that femoral nerve has two divisions, anterior and posterior. So we have to enumerate all the cutaneous, muscular and articular branches from anterior as well as muscular divisions of the femoral nerve and the related applied. In this we have to also draw one line diagram to show the branches of the femoral nerve. Now this is the exercise which you have to do in your file, and this is the draw well labeled diagram of the femoral nerve. So you have to draw this diagram as it is in your files and use the same colors, that is yellow color, for depiction of the femoral nerve. So this completes the topic, the femoral nerve. Thank you.